healthcare. Now, one of the people that we work with, Sakina Datu, is from Tanzania. And a few weeks ago, on the occasion of Pfizer's annual general meeting, she, along with a cohort of campaigners and other patients and activists, went to the UK headquarters of Pfizer to deliver what I suppose amounted to a pantomime blood money delivery, because in her view, and in the view of lots of people that are active with us, in my view, the amount of pandemic profiteering that has been going on at the expense of the lives of people across the developing world is completely immoral and unacceptable and has to end. There have been 4 times as many deaths in low-income countries from COVID as there has been in high-income countries. And we know that people like Sakina's own father could have been alive today if it were not for the gross vaccine apartheid and inequality seen in the scale up and rollout of vaccines and other COVID technologies. We also work with people like Izzy, who's living with a long-term chronic condition, who's been shielding since the start of the pandemic and is still shielding today. She's shielding because her life is still at risk as the pandemic continues, despite the shift in rhetoric from central governments, despite the move away from coverage of the pandemic in the media. It's still very much a daily reality for both people with heightened vulnerability to the pandemic within Ireland and the UK and Europe, but also in the lives that are being lost every day, particularly across the global south, as a result of this pandemic. So this is not entirely, but a hugely unprecedented situation that we find ourselves in. This is a global pandemic where we would have believed nothing would have been left on the table. Every effort would have been made to try and save as many lives as possible. And that has not happened. We've been campaigning along with the rest of the People's Vaccine Alliance, like our colleagues in Access to Medicines Ireland and groups and governments across the globe, to put saving lives ahead of everything else. Let's prioritise protecting people from this pandemic and bring it to an end as quickly as possible. And in order to achieve that, as we've seen in past pandemics and with other global health crises, one of the critical barriers to achieving equitable access to health technologies has been enabling us to overcome the monopolies that allow pharmaceutical companies to control supply, access, and price of those technologies. And the proposal from India and South Africa, and supported by the vast majority of countries around the world, to waive intellectual property rights across COVID technologies, is one which I would argue no serious actor opposes. Why would they? This is a pandemic. Why would we not try something which has been proven to work in past global health contexts and which evidence suggests could work and contribute to solving this crisis today? The reason I would say that anybody opposes this is based on 2 core motivations: financial interest and political interest. I can't see any serious actor that has been out there advocating against waiving intellectual property rights that doesn't have a vested interest in maintaining the status quo and preventing those monopolies from being waived. That's maybe kind of an obvious statement, but I think it's not been said perhaps often enough. The people that are motivated to act in this situation against breaking these monopolies have a pure self-interest driving their behavior. And whenever we're in the context of a pandemic where over 6 million people have died, that's a terrible indictment of their political choices that are being made. I say financial interests. We've had at least 9 billionaires created as a result of COVID vaccine technology. We've seen Pfizer, one drug company alone, double its entire global revenue thanks to sales of the COVID vaccine alone. And we've seen in total about $34 billion of industry profits generated as a result of this pandemic. We need to be really clear-headed about that. That is an unbelievably large amount of money. And with that money, you buy influence. And so the people that are seeking to maintain the status quo where these monopolies are protected are ones who have been influenced either directly or indirectly by the financial gains that are to be made by maintaining that situation. And so the political interests of Western governments, particularly the EU and the UK, the government of Ireland, very clearly have an alignment with the amount of investment that comes from the pharmaceutical sector and the direct political payments that the industry makes to political individuals and organizations, and indeed the political influence that having access to a supply of vaccines as easily as possible buys the pharmaceutical industry. And we can take that further. If we look at some of the arguments against waiving intellectual property rights on vaccines and other technologies, the arguments are constantly evolving. So we heard at one stage from Thomas Cuny from the IFPMA, the pharmaceutical trade body, that this was the start of last year. So in January, February 2021, the actual problem was there was simply no further production capacity out there. We could waive intellectual property rights protections, but it would make no difference. There simply isn't another manufacturer out there that could come online and start producing these vaccines. Frankly, that's bullshit. And it was proven to be bullshit within a matter of weeks of his statement, when members of his own pharmaceutical trade association managed to source and identify further manufacturing capacity. Since then, we've had examples of large numbers of manufacturers who have put their hands up and said, actually, we could do this if we were given permission and given the technology transfer that's required, the know-how that's required to do it. Hundreds of millions of more doses could have been made available that weren't. We've also seen examples of very racist arguments being used against this. The idea that Africans couldn't possibly scale up their capacity to do this, that there are heightened levels of vaccine hesitancy across low-income countries. Really arguments that drew very strong echoes of the kind of racist arguments that were used against scale-up of generic access to HIV treatment 20 and 30 years ago. We've seen very obviously false arguments being made against this. The idea that the intellectual property monopolies on these products were the thing that spurred the innovation that led to their creation, when we know that 90% of the financing for these products came from public sources. So the idea that it was these monopoly protections that were the key driver is a rewriting of history and reality. We've also heard arguments that the systems that we have at the moment to facilitate generic and non-branded production of these products are sufficient to solve the problem. But I mean, as we can see with the levels of inequity that are continuing persistently to exist today, those existing mechanisms within intellectual property law are not working well enough. We've also heard arguments that there's no evidence that intellectual property is a barrier. This is something which we've had asked or stated by the UK government in particular repeatedly throughout the pandemic. To our mind, that's a completely wrong question. When we're in a pandemic situation, we should be doing everything, whether there is a guarantee it will work or not. We should be trying everything possible. And in fact, we've asked repeatedly, we've flipped that. We've said to the UK government, well, actually, can you provide us with any example of any medical technology in history that was protected by monopolies, that hasn't had a barrier, or that hasn't had access barriers, that hasn't had challenges being rolled out equitably around the world? Simply is not the case that there has ever been a situation where there's been a medical technology that was patented, was protected by monopolies, and that didn't have inequitable access. We've had I've learned a new term. We've been sea lioned by the UK government with constant requests for evidence to justify the things that we're demanding, and no effort on their part to provide any evidence supporting the positions that they're taking. And we've had to write to the UK government, and we've recently, with allies in the UK, CC'd in the head of the WTO and other WTO delegations to highlight that the UK government is using arguments of basically a insincere and a false consultation with NGOs to delay it setting out clearly its position on the waiver. There have been any number of frankly ludicrous and incredibly enraging arguments used against this shift in the way that intellectual property rights are utilized within the context of a pandemic, and none of them stood up to scrutiny. We have seen through this pandemic an unbelievable rewriting of laws and of rights in order to protect life as much as possible. We've seen extreme reductions in personal and societal freedoms in order to manage this pandemic. And I'm not saying those things were wrong, but I'm saying it's really interesting that there are certain rights and laws which are able to be suspended or to be rewritten in order to preserve the greater good that is to save lives within this pandemic. We've seen countless people die alone. We've had freedom of assembly suspended in many contexts. The levels of privacy and data that we have rights over have been either suspended or reduced, and some of those potentially permanently as a result of this pandemic. But somehow, intellectual property rights are sacred, more so than any other law or right that we've seen. And we have to ask the question why that is the case. Why do intellectual property rights hold this elevated level of protection within our society? And I think really simply we come back to the financial motivations of the actors involved. No other industrial sector spends more influencing the decisions of our governments and the regulatory authorities within our governmental ecosystems than the pharmaceutical sector. Head and shoulders above the rest, the pharmaceutical industry invests in a very sophisticated way to shape the decisions of our leaders. And it has led to this situation where there is a corruption essentially at the heart of how decisions are made around access to medicines and access to healthcare. And it is deadly. And we are seeing the evidence of that every day. And the people that we work with, both in the UK and internationally, are paying with their lives for that complicity. And I think it's
Dermot, can I just get
really
you
important.
Sorry, Dermot, can I just get you to wrap up? We're just running to the end of your 15 minutes.
My last point. This is my last point. I think my internet is going a little bit as well.
Okay.
Can you hear me all right still?
We can hear you now, yeah. You did drop off there.
Okay. I'll be very quick just to say it's really important to note that this is not a COVID-specific issue. When Gilead were pricing their new hepatitis C product, sofosbuvir, they made calculations about how much money they could charge in order to get away with it, basically. Their calculations were not about cost of production. They were not about the value in terms of health outcomes that the product was generating. It was simply a calculation which was made public during Senate hearings at the time in the US about price that they could get, the maximum price they could get, which would be tolerated without political backlash, essentially. So the motivations of government or of companies are purely driven by the political context within which they're made. We see right now Vertex, a drug company which is producing cystic fibrosis treatments, selling a product for $311,000 per patient per year. and basically giving up on patients across the majority of the world, with only 12% getting access because it can maximize its profits in the rich world. We're even seeing again within HIV and AIDS a new product from GlaxoSmithKline and ViiV that protects against transmission of HIV being priced at $3,700 per dose, when we know that doses could be manufactured for just $2.60. This kind of profiteering is endemic within the pharmaceutical industry. And if there was ever a moment where we need to reassess how we structure the development and access to medicines, then there's never been a better time to reassess it than within the current context of this pandemic, when the rules of the game have so obviously been shown to work purely in the favor of the rich world and the people that those rules make richer.
Thank you very much, Diarmuid. Your expertise and your passion really shine through, and I'm sure we'll get back to many of these extremely important issues that go, of course, well beyond COVID vaccines, treatments, and diagnostics, and even access to some of the information that's needed to make evidence-based decisions about these issues. So I'm going to move on and welcome Senator Alice Mary Higgins. Thank you so much for joining us as well. We understand you were at a committee meeting, so I'm sorry that we slightly changed our running order. We didn't want you to have to jump straight into a talk as soon as you joined. So just you'll be very well known to near everybody, but we do have some international attendees as well, which I'm delighted to say. And just to introduce you, you're an independent senator on the National University of Ireland panel, and you're leading the Civil Engagement Group in Shannon Éireann. And you previously worked at the National Women's Council and for Trócaire. And in December 2021, you led an incredibly successful situation in the Shannon, where you proposed a motion in support of the TRIPS waiver, and it was carried unanimously. So we're really delighted to have you here today, and please go ahead.
Sure. So thank you very much. And again, apologies, as I was running from another committee meeting to come to this, but I think this is a really important event, and it was also actually really good to hear Diarmuid and to hear the I think very rightly the challenging in terms of the political, the economic pieces around this, and I'm going to go into them in a little bit more detail as well. I suppose fundamentally something I in the early part of COVID, we were hearing a lot about, a lot of the narrative of solidarity, and indeed, at local level, we saw people, the genuine human response of people was a response of solidarity, with their neighbors, of how do we help each other, how do we get through something that is this huge challenge. And people made, as he outlined as well, not just that there were strong government rules, but also people made huge personal sacrifices for that collective good, to recognize that that idea of the common challenge. And there were, of course, inequalities within countries in many different ways that we don't have to tease out all of now, but that are important and that have been unpacked more and more since. But there was this moment of hope. This idea of public governments, public money was directed very intensely towards the development of a vaccine. And you had this huge public investment, as he described, I think it amounted to something like 69 billion totally. So, a huge, or more, 90 billion, I'm looking at my figures here, but the vast majority of funding for the development of the vaccine was huge public money being invested, both in the research and, of course, in pre-ordering, in that guaranteed market in terms of the vaccine. So it was huge public investment. And there was also, I think, a really hopeful architecture put in place. So people weren't responding, simply in terms of this is a brand new thing that's never happened before. Actually, the World Health Organization, projects like UNAIDS, all those who had dealt in the past, and indeed those who had anticipated public health crises like this global public health crisis, had put in place architecture. For example, the really brilliant initiative from Costa Rica and the World Health Organization, the idea of a COVID technology access pool, the CTAP, the idea that there would be a pool which would provide a mechanism whereby technologies in terms of treatment, in terms of diagnosis, in terms of vaccination could be pooled and shared. And that was put there alongside the idea of COVAX that would ensure that we got to a critical threshold of that most vulnerable 20% in the world being vaccinated as early as possible. I mean, these were really good ideas. And really early on, again, before the vaccine was developed, South Africa and India have brought forward proposals to the World Trade Organization saying, when the vaccines come on stream, as they are likely to soon, we need to make sure that we don't have unnecessary barriers in their distribution and manufacture from the trip. So we need to utilize the mechanism which is there, which has been used in the past in terms of HIV medication for a TRIPS waiver, so a waiver on those intellectual property rights. So again, when I was struck by what Dermot said about leaving nothing on the table. We actually knew what we needed to do. It was there, it was planned. But what actually happened, unfortunately, is just a couple of months later, when the vaccines were finally, were emerging, and we had, we were going into a Christmas period where the news was constantly of another vaccine that might work and another vaccine that might work. In the new year, we suddenly saw that what wasn't happening was that kind of global public health response, the architecture of which had been set out, the demand for which had already been brought to the World Trade Organization. And instead we saw, I think it was the line on the cover of the Lancet, which is, one of the world's premier health journals, which is basically that rich countries behaved worse than anyone could have imagined. And that was, an extremely concerning thing, where we found a huge amount of the hoarding of vaccine. We found artificial bottlenecks. And again, it's really important. A lot of the discussion was, around, the distribution of the vaccines, who will get, who might get them. But the actually really crucial issue was we had artificial bottlenecks on the manufacture of vaccine through, the unnecessary limitation in terms of the scale of manufacture. And that came in very early. And I want to kind of just maybe to come back on the political piece is, and even on the economic piece, so the core thing is public health and the incredible human responsibility we have to each other in relation to something like this in terms of public health. But what was really interesting is there's a tension within the political space and within the economic space as well. So, on the one hand, you actually had quite a lot of public representatives of countries right around the world who represent, people on the ground, really calling for these vaccines to be shared. So you had in Ireland, the Foreign Affairs Committee in March 2021 called for a TRIPS waiver to be used. In June, you had the European Parliament voting, calling for a TRIPS waiver. So those are the kind of the parliamentary representatives. You had, and again, and I'm leaving aside, of course, the fact that, over 100 countries were supporting that call for a TRIPS waiver, as well as the World Health Organization at the WTO meetings. You had then in Ireland, in the Seanad, where I sit, really strong support for a TRIPS waiver. And we've had individual ministers who've said that they support a TRIPS waiver in Ireland. But what you did have was a very small government space, with some governments, and in particular then the European Commission and the officials who negotiate on trade on the part of the European Commission, really standing in the way of progress on the sharing, on the scaling up of global vaccine manufacture. And it was very interesting for me as a politician. You get the argument, and people will have seen, but the arguments that were being given, because many of them were clearly disingenuous. And it was a rolling series of arguments that didn't stand up, but each argument would buy another 2 months of profit maximization. Each argument would mean that, we expected there would be I remember really even hoping that in April 2021, the TRIPS waiver would be agreed. But then it didn't happen, and then it pushed on, and suddenly you're arguing again for June. And each quarterly return was returning absolutely massive profits for a very small amount of companies. So again, the arguments were, and I don't need to even debunk them because Diarmuid has done so, the idea that there wouldn't be manufacturing capacity in developing countries. Again, that was absolutely disproven. There's entirely appropriate vaccine manufacturing that could very quickly be adapted. The fact that the vaccines, indeed the nature of the vaccines, the mRNA vaccines, they were in fact easier than some biologic vaccines in terms of manufacture. We also had brand new facilities being created in European countries that were manufacturing them from scratch. So there's absolutely was no credibility to that argument, but that was used for a period of time. Then the charitable argument was used. The idea that, you know, we can gather together and we're going to make this big charitable effort, and there'd be a big concert and there'd be an ostentatious promise of a donation. But what we knew was happening actually was you were having donations of sometimes very close to expiry date vaccines, not necessarily the best vaccines for a particular setting, being ad hoc delivered. And from every country that has had, in terms of wealthier countries where we have had good access to vaccines, you know, public health rollout requires predictability. People need to see their neighbors getting vaccines and that works. People need to see, they need to know that they can plan to get a vaccine because people have lives, have busy lives and huge responsibilities. So not having a predictable supply of vaccines leads to, in fact, the inability for many countries to have the kind of planned public health rollout of vaccines that they needed to have. And then yet that was then thrown against these countries that they wouldn't have the capacity to roll out vaccines simply because they weren't given the guarantee, the core that they needed to provide that. So again, we had these disingenuous arguments, each coming, leading to another excuse to not progress, another TRIPS meeting of the WTO, which didn't work. And what was also happening in the meantime is millions of lives were unnecessarily lost. And looking from a global perspective as well, many of those lives were health workers on the global front line. And there's one thing that we know from this pandemic is that when you face something like a pandemic, which can travel everywhere, public health services are in fact a global front line. It is where things get addressed. It's where you identify the new strains. It's where you contain outbreaks and spread. It's where it's what we rely on, not just for this public health threat in terms of the pandemic, but future public health threats. And it is an incredible concern and loss to the world that so many health workers, including health workers in underprovided areas of the world, have lost their lives unnecessarily because of the failure to share vaccines. And that is something that is a huge indictment and a huge vulnerability that we have collectively created globally in terms of future health threats. And that's why I don't think it is a surprise that in last November, we saw nursing unions from 28 countries file an appeal to the United Nations. So representing over 2.5 million healthcare workers file a complaint to the United Nations around the injustice that had been done. So again, I just wanted to kind of give that context for the motion in the Seanad. What was really interesting about the motion in the Seanad, I brought on a motion, it was a strong motion demanding that Ireland take a position as a country that claims to champion human rights in favour of a TRIPS waiver, that it would press and push publicly for the European Commission to take to stop obstructing a TRIPS waiver. And there was an attempt to bring a government counter motion. So there was a proposal, and the government counter proposal came with the latest in a set of evasions and delays, which was the idea that we might use the already existing flexibilities in TRIPS, which again, for the public, sounded like a TRIPS waiver, flexibilities in TRIPS waiver. But of course, it was basically mechanisms that we know don't work, like compulsory licensing mechanisms, which haven't been used precisely because they don't work, and to kind of rebrand them and repackage them. And it was yet another delay, and it was to give another 3 to 4 months of profit making. But what was really notable is that the government representatives in the Seanad, they came out very strongly in support of my original motion. And in fact, with pressure from them, the government counter motion was withdrawn, and we had unanimous support on a demand for a TRIPS waiver. Unfortunately, despite that message from one of our houses of parliament, Minister Varadkar has not, and again, I think despite other ministers giving positions in favour of TRIPS waiver, has continued to champion the intellectual property argument. And I think quite embarrassingly at the EU, European Union, African Union Summit, where Cyril Ramaphosa very eloquently, I think, and strongly made the point of, if we cannot meet each other on this, a matter of life and death, how can we meet each other? We had Minister Varadkar saying that he didn't want countries to take advantage of the pandemic to get at, to loosen intellectual property laws. And I think that was a really shameful message for Ireland to have sent into that space. And again, I point to the fact, and I'm going to come into the greatest tragedy has been the human tragedy and the avoidable human tragedy, and the shameless sacrifice of other people's lives for profit maximization. And I say profit maximization because even with the TRIPS waiver, there is absolutely scope for companies to make substantial profits. They can still make profits in terms of wealthier countries who may keep their national level intellectual property laws, even if the WTO rules were suspended in terms of TRIPS. So it's not simply about profit, it's about profit maximization. And I think it was also a well-made point that other point, which it was made strongly, I think, by India as well, and by South Africa, that other businesses, small businesses, cafes, play groups, every kind of small business has made sacrifices for public health reasons. Yet these very large companies, this handful of companies, have not been asked to make any equivalent sacrifice at all. And it is a handful of companies. So again, even from an economic perspective, the global loss in trade, in the fact of the extension of the pandemic, has effectively meant that all of those small businesses around the world who exist unnecessarily in an excessively prolonged period of pandemic and crisis are effectively subsidizing profits for a very small number of companies. So again, this is kind of to bring us to kind of where we are now. I think that as well as not be, from a public health, from a humanitarian, from a human rights perspective, being a terrible a disgrace. What we've also had is that from a political and a diplomatic measure, it has been extremely foolish. And I believe that the European Union's relationships with many countries have been damaged and continue to be damaged by the failure to move on this. And we saw that at the EU-AU summit. And I really see it in the area where I also work in terms of climate, because I sit on the climate committee. And I think I'll maybe move to the future. We still need a TRIPS waiver. New variants are emerging. It was highlighted that they would emerge. They continue to emerge. Each new variant carries new risks. It carries, in some cases, more long-term consequence. Some have high mortality, some damage and weaken the immune system in the long term. Each one is another blow to the public, to our fellow humans, and to the global public health. So we do need a TRIPS waiver still, but we also need to learn from this. So again, it's not over, so we need to address the pandemic still, but we also need to learn from it. And there is a very strong message that we cannot rely on structures based entirely on profit maximization. It is not what motivates innovation. As I think the lie has been given to that, because in fact, it was public funding that motivated the innovation. And it is in fact an obstacle to addressing common challenges. And in terms of climate, we need to go back to that architecture that was proposed at the very beginning. The idea of spaces where technology would be pooled. The idea that certain areas cannot be subject to intellectual property constraints. That when we have solutions to common problems, as we will face common problems on climate, we need to spread those solutions as wide and as large a scale as possible, as quickly as possible. And that means really reimagining research and development. Should we be pouring tens of billions of public money into private companies when they will not step up when it comes to the actual crunch? Or do we need to be looking at public-public partnerships? Do we need to be having, in general, other rules and new rules so that we're not facing a time lag, that kind of 2 months and another 2 months and another 2 months, unnecessary stalling when it comes to acting swiftly on problems which threaten life? I'm going to maybe finish on that. I again, Tedros Ghebreyesus from the World Health Organization, he warned us that the world was on the brink of catastrophic moral failure, and that the price would be paid in lives and livelihoods in the world's poorest countries. We have seen that, sadly, despite the warning, we have had catastrophic moral failure. And we now have an incredible job of rebuilding trust, global trust, rebuilding new mechanisms for global cooperation that do not have hostages to fortune in terms of shareholders' returns. And we need to ask ourselves, I've maybe finished on this, I still love this quote, and I'm sure it's used by, Jonas Salk, the idea of, the person who provided the world with the polio vaccine, again, not motivated by profit. And he talked about the idea of being a good ancestor. I think that we now need to ask ourselves, not just are we good ancestors, but are we good fellow humans right now? So not just to future generations, because in something like climate, the existence of future generations is not guaranteed. But are we good fellow humans on this world at the moment? Can we good in conscience believe that we are acting as humans should towards each other? And that, I think, is a really important challenge. And it's something that all of us, those of us in the political space, will need to fight for. And I know that NGOs are fighting for. And we believe, and there can be no forgetting or brushing under the carpet of these failures. And again, that's why UNAIDS, because they had those battles in terms of HIV medication, they know the mistakes that have been made in the past. This goes down as another one, but also we need to continue to battle. And as well as looking to a TRIPS waiver, we also need to be looking to redress, to support and restore the global public health systems of developing countries who have taken an unconscionable blow due to greed. Thank you. Sorry, I should hand over to next. Apologies.
No problem. I think we've lost Susan temporarily, so I'm going to hand over to to Candice Sahoma. So Candice works for the Médecins Sans Frontières Access campaign in South Africa, and she's going to give us some insights into some of the on the ground issues there. Thanks a million, Candice, for joining us.
Thank you. Thank you so much for having me, and good morning to everyone. So as introduced, I'm Candice Homa, and I'm the Access Campaign Advocacy Advisor working based in South Africa. I think just briefly touching on, just a bit of background in terms of what we are gathered here about today around the TRIPS waiver, which was proposed by South Africa and India following, global inequities to access for life-saving medical tools, which mainly affected and leaving behind low and middle income countries. 18 months later from when the proposal was made by these two countries, there has been developments on the text recently, although it has been unfavorable. And as MSF, there is a raging concern about the current text, which is not the waiver proposal we have initially supported and which many other countries globally have supported. We believe that this will set a negative precedent if countries, fail to include essential medical tools like vaccines, therapeutics and diagnostics, as well as other underlying, technologies, ingredients, materials needed for production, and fail to include all countries in a global pandemic. And I believe that it is important to include everyone, all countries, as we are all affected by this pandemic. And I think also just, on the text, there are also a number of complexities that have been added to the current text, which are very problematic and very limiting in nature. And one of the examples is around the anti-diversion requirement, which is included in the current text. It basically requires countries to not re-export vaccines they have received or manufactured, which is very problematic. I think in a pandemic, it will be important to encourage countries to share capacities to redistribute vaccine doses and other medical tools. There are also regional and collective, procurement initiatives involving multiple countries, and these practices would most likely involve, re-exportation of vaccines and other medical products. Therefore, these, anti-diversion clauses in the text, in the middle of a pandemic does not make sense from a public health perspective. So, there is a general, from the initial TRIPS proposal, there is a general obligation on anti-diversion. So we think that this will basically set this negative precedent, and to have this kind of a clause for a discussion in a global pandemic. And I think it's something that we have seen also, as in the case of Gilead with sofosbuvir, where they had this clause, this anti-diversion clause, and it excessively affected access. And I think it's something that I'll share on the text, our criticism on that. And just also coming back to South Africa and just going beyond, and as I mentioned that the current text is very limiting to vaccines, and what we believe that it has to go beyond that. It has to go covering what it initially proposed, covering diagnostics as well as therapeutics. And what we see in South Africa, for examples, in the case of baricitinib, which is a COVID-19 medicine that has been recommended by the WHO and is included in South Africa's guideline. The Eli Lilly has filed for patent in South Africa, and which basically blocks generic production and supply of this medicine in South Africa until 2029. This medicine is sold by the originator company, which is Eli Lilly, at an amount of $270 for a treatment course of 14 days. Yet a similar treatment course for generics in Bangladesh and in India can cost about $5. So there's a huge disparity there. And unfortunately, for a country like South Africa, low and middle income countries, where we have even our national health system strained due to other priorities, we actually paying that price for baricitinib. And as civil society, we have called for the revocation of Eli Lilly in our current patent system, and similarly, also we are encountering similar issues with the current mRNA hub that has been developed or that has been established to develop vaccines to mitigate the global inequities. They are also facing confronting similar issues with the current patent that has been filed by Moderna, which could block the ability to supply this vaccine. We have called for the revocation of both these patents on the Eli Lilly medicine, as well as the mRNA technology, to allow for local manufacturing. However, it's still, I think it's very important to also recognize that with the current mechanisms in place, a revocation would take a while, would, be a very expensive process for South Africa, or for any party that actually goes that route, would be very expensive and a very tedious process. And hence, we emphasizing on the need for having like a TRIPS waiver, which would make things much easier and do away with these current issues to allow for local production. So I think it's I think just to wrap up, I think it's such an important thing, and I think for countries, particularly in Africa, who have shown that we actually have the capacity, we do have the willingness to produce for ourselves, and we're not just saying this because we're saying this because there is existing capacity, there is existing skills to be able to do that. And what is needed now is for high income countries to open the channel. We can't be trapped in the system where we are expected to depend or have these charity models which are unsustainable and which limit our own ability to respond to the current pandemic. And therefore, things such as a TRIPS waiver, not this current text as we have it today, a TRIPS waiver would enable us to move forward and be able to better respond to the pandemic that we are currently faced with today. So thank you so much.
Thank you, Candice. And I'm very sorry. Just as Senator Higgins was finishing, I had a power outage, which I wasn't anticipating, but I believe somebody stood in for me. We have one question actually, Candice, that I might ask you just, because you're well within your time, and it's from Pauline Conway, and she wants maybe us to consider the arguments around improving developing countries' capacity to deliver vaccines via health system strengthening, and that's just as or even more important than a TRIPS waiver. I wonder, Candice, if you want to make a comment about that. So that idea of health system strengthening and what we can do about that.
Yeah, I think what the current pandemic has, it has really kind of shined the light on the need for us to really prioritize health. And unfortunately, in this case, it has also shown that, we really need to also improve on our, our ability to, particularly for low and middle income countries. It has also kind of shown the imbalance, the power imbalance, which has, which continues to affect us situated in low and middle income countries. And it's something that we need to really deal with head on, because we cannot continue to do business as usual. We cannot continue to live in a system that is, or continue to work in a system that is imbalanced and leaves us to basically cry and on the foot of the high income countries to save us, to help us. And what we are saying is that we need to improve, we need to better ourselves, and we are, as low and middle income countries, as Africa in this case, we have come to the table to say we are willing to do this on ourselves. What we need from high income countries to support us to be able to do this, we need to improve our system in all fronts. And and I think for us in this case, it will also really put the urgency on us even improving on our ability to manufacture to better respond to the pandemic.
Yeah, thank you very much. Not only is it about a power imbalance, but I often feel that high-income countries are actively obstructing health system strengthening in other parts of the world. So I think we will have lots of time for panel discussion at the end, and we'll come back, I'm sure, to some of these issues. So please do keep putting your comments and questions into the Q&A function. And what we'll do now is we will have, instead of a 10-minute comfort break, we'll have a 5-minute break, and we will resume exactly at 11 with Luke MacDonald, who'll be giving us insights based on his expertise on the TRIPS waiver. So thank you. We'll see you in 5 minutes exactly. Hi, Luke. We'll kick off now in a minute.
Okay. Just give me the word.
Okay, well, I'll just we'll wait till it hits exactly 11 on the button. People will be off getting their coffees and other things. Okay, we'll kick off again. So welcome back, everybody. I hope you managed to get a coffee or whatever else to keep yourself going. I'm delighted to welcome Dr. Luke McDonough, who's Assistant Professor at the LSE Law School. He undertakes research in the area of intellectual property law and has recently published an extensive examination of global COVID-19 vaccine inequality in the context of intellectual property law. It's been interesting seeing the expertise that the pandemic has brought to the front. And it turns out that having expertise in intellectual property law has been critical for highlighting inequalities. So thank you very much, Luke, for joining us today. Go ahead.
Well, thanks, Susan, and thank you to all the panelists for inviting me. It's my pleasure to be part of the event. I think at this moment, when none of us are sure whether we are over the worst of the pandemic, whether the pandemic is slowly coming to an end, or whether we may be around the corner from the next dramatic variant that changes the game, it's very important to learn the lessons of the last 2 years. And in terms of the relationship between intellectual property and the operations of big pharma, the largest pharmaceutical companies, it's quite notable that the three key vaccines that have been used certainly in the West more than any other and are statistically the most reliable ones, that is the BioNTech Pfizer vaccine, the Moderna vaccine, and the Oxford AstraZeneca vaccine, all have their roots not only in public funding, but actually in inventions at public institutions. So BioNTech, which created obviously the BioNTech vaccine that Pfizer is merely the manufacturer of, not the inventor of. BioNTech is a spin out from a public university in the town of Mainz in Germany, the Gutenberg University. Moderna has benefited massively from not just public funds, but also inventions co-created with the National Institutes of Health, a government agency in the United States. And of course, the Oxford vaccine, of which AstraZeneca is the manufacturer, was created almost entirely with public funds. So there's certainly a role for the private sector in scaling up production at a time of massive public emergency. But it certainly isn't the case that private activities were the sole reason why these vaccines were invented in the first place. In fact, the three most iconic ones of the last 2 years have their roots in the public sector. So it's worth, from taking that point forward, to think about the idea of IP rights as private property rights. Notably, when the agreements were made between the various governments and these companies at the time of crisis, governments understandably didn't attach conditions to the way in which vaccines would be shared, the way in which the know-how and knowledge would be shared. Governments were acting at a time of crisis and they simply didn't think about that element of it. But that's a lesson that we need to learn as well, that the governments at a time of crisis need to put into place measures for knowledge sharing and dose sharing that are genuinely towards the goal of equity and are not just on a highest bidder basis, which is essentially what happened in the first 6 to 8 months of 2021. In terms of the actual campaign for the TRIPS waiver, it's also important to situate this in the realm of lessons that we can learn. And one lesson that we can learn from the last 2 years, just as we should have learned from the time of the HIV/AIDS crisis, is that the TRIPS agreement operates in a highly uneven and unequal way. And this should not be a surprise to us or to anybody. The TRIPS agreement essentially changed the development model that had worked all the way from the 19th century through most of the 20th century, in that countries that are at the lower and middle income end of the spectrum need to be able to copy technologies in order to develop their own innovative capacity. India and Brazil, for example, which today in the global south have the best capacity to manufacture pharmaceuticals, deliberately did not protect medicines using patents during the 1970s and 1980s. The fact that they didn't allow patents on pharmaceutical products allowed them to copy, to learn, to reverse engineer, and to build up their own capacity as suppliers of generic medicines. So that model, which the rich countries like Switzerland, Japan, Germany, the Netherlands, and so on, had all followed in their own way in the late 19th and early 20th century, was closed off for the vast majority of lower and middle income countries, with only a few exceptions for the least developed countries, by the TRIPS agreement in 1994. The TRIPS agreement was essentially meant to spur technology transfer. That was one of the aims, or apparent aims, of it, by protecting IP rights on a global basis. But of course, it has ended up supporting the growth and economic model of the high-income countries, and it has left most lower and middle-income countries in an import dependency position with regard to high technology goods, particularly medicines and vaccines. And what a surprise! The two countries today that are still in a position to look after their own vaccine needs, Brazil and India, are the ones that took the opposite approach during the time when they were building up their own capacity. So it is simply not the case that strong intellectual property rights everywhere are actually a spur to development and to innovation. As we have seen, we need the capacity to produce medicines and vaccines to be spread around the world in a far more distributed way than we currently have. As we've already heard, it simply isn't acceptable for the global south to be relying on donations from elsewhere. We've seen how this has corroded support for vaccine take-up in parts of Africa. A recent piece in Politico showed how the fact that vaccines that were getting to Africa was seen as being cast-offs from the West, vaccines that the West had moved on from. They were not things like the mRNA vaccines that we've tended to favor in the last 6 to 8 months in the West. And so in Africa, that has played a role in increasing reluctance to take vaccines, along with the short time left before those vaccines expire and other problems with that importer donation dependency model. So what we need to do, and the TRIPS waiver is part of this as a global approach, is to encourage the building up of capacity in various ways in regional hubs. South Africa has taken a leading role in this. And there are positives that we can see that have come out of this campaign. For example, along with this campaign, we've seen pressure coming from the TRIPS waiver, which is the biggest challenge to the intellectual property system in the last 2 decades, that has put pressure on companies like BioNTech and Pfizer to agree licenses with some providers in the global south, to agree licenses with the medicines patent pool to allow generic production of certain treatments. So this kind of pressure that this campaign has created has pushed companies to do more. And they need that pressure because, you know, within a shareholder capitalism model, companies will simply do what they can to make the most profit. Only a campaign such as this will push them to do better and to do good. We've seen the WHO taking a lead role in helping Afrigen and the WHO mRNA hub to set up a distribution network in the global south to take mRNA technology around the world. That's an incredible positive that we've seen in the last couple of years. There's a vaccine called Corbevax developed in the United States at a Texas institution that is being spread around to India, to Botswana on an open source basis. That's incredibly inspiring and will help to build capacity in those places. In fairness to AstraZeneca, of the major facilities, they have provided the most tech transfer to the global south, to India, to Brazil, to Thailand, and several other places. So the pressure that this campaign has created has already achieved an enormous amount. This does bring us to the text that is currently being negotiated. So even if we can say the campaign is already a success, as has already been said, the current text that's being negotiated is quite flawed and too narrow to really do the job that we need at this point, which is to increase the flexibilities within the system to allow freedom to operate, particularly for treatments which are in massive global supply right now and are not currently included in the draft that the WTO is negotiating. So along with some co-authors, I've recently, just this week, published a paper talking about the deficiencies of the current draft that's being negotiated and offering several suggestions to improve that, and as terms of a minimum modification that needs to be made for that to be supportable. Because the current draft, as it currently is, simply doesn't go far enough. One final thing that has already been mentioned by Alice Mary, but I'm going to conclude with, is that it is simply untrue and ahistorical to say that something like the TRIPS waiver will kill the incentives for innovation in the private sector. We've seen with the production of generic HIV/AIDS drugs that you can have the global south producing and taking care of its own needs on a generic basis, operating alongside a high-income market that still has relatively high prices, because those of us in the West are in a high-income economy, and still has lots and lots of innovation for new HIV/AIDS medications. So the idea that a market for generic vaccines in the global south will kill innovation incentives is simply untrue, and as I said, goes against the history of development. The one thing that high-income countries can do, should we get a waiver, because the waiver is mostly for low-income and middle-income countries, but the one thing high-income countries can do is share data with the regulatory authorities of global south countries. When you create a generic medicine, you often have to do your own trials in order to bring that to the market safely. Some of that will be inevitable in the context of creating a generic vaccine, but some of it can be sped up by the sharing of data from the EMA in Europe, from the FDA in the US. Where you have a situation like in South Africa, where Moderna has not filed a full regulatory dossier, if the US and the EU were willing to share the data they have on the Moderna vaccine with South Africa, that would be tremendously useful to the South African authorities in helping Afrigen not only to copy that vaccine exactly, but also to help them speed up the trial process for getting that vaccine to the point where it can be rolled out. So I'm going to stop at that point, and I'll hand back now to Susan.
Luke, thank you. Thank you very much. That's, a really useful and incredibly current update. It'd be brilliant if you had a link to your most recent paper that you could put into the chat for everybody at some point, if that was possible. I think everyone would be very interested to look at it. It sounds like you're suggesting solutions rather than just pointing out the deficiencies. There's one question in that I think might be particularly relevant for you and other academics. It is, what can global health and human rights lawyers and academics do to help civil society organizations in facilitating access to essential medicines, including COVID vaccines? So the role of academia in this whole process.
Yes, it's a very, very, very good question, Susan. I think that we should approach these questions as we approach the other academic questions that we study, which is with a lot of rigor. I mean, I have seen, as Diarmuid and others said earlier, I've seen some statements made by industry bodies and even a small number of academics where the assumption is that the patent system is only a positive and only creates positive incentives. And one of the things that triggered the interest for me academically was, is that really true? And actually, what are the incentives that are created by the patent system and the IP system more generally? And we can see with some of the behavior of pharmaceutical companies in the last 2 years that actually there are perverse incentives that are sometimes created within the system. It's not that the system is entirely rotten, but it's a system that can lead to profit seeking. So for example, when a company has an opportunity to sell a third dose of an mRNA vaccine to the EU or the US, which was the case of Pfizer and BioNTech last year, they raised the price in doing that. And it also, of course, showed that they had an incentive to sell to the highest bidder rather than to sell to the low income or middle income country that was essentially at a different level of the pricing. So this is the problem where you treat something that should be a global public good as a commodity. And so those of us in academia can approach these questions with our usual rigor, and vigor, and look to see whether these narratives that are out there are actually true or not, and to investigate and to publish our reports and our articles on that basis. And there's a lot of interesting, for example, last year, US Congress put out an incredible report based on the US pharmaceutical industry, which was quite scathing in its reporting of the behavior of some major firms in terms of price gouging and preventing competition and so on. So there's a lot that is out there that is really rigorous research that helps to counter some of these kind of establishment narratives that are really too simplistic and full of assumptions. So I think that's the direction that we need to go in academia, simply apply our best methods to answer these, to ask these questions and provide answers that may be then useful for governments, for campaigners, and so on.
Yeah, I think that's really important. And of course, there's also the huge issue about how we communicate some of that expertise, the language we use, and also the access we have to media, wider media dissemination, because particularly during the pandemic, I think there may have been less critical consideration of some of the issues. I mean, something like a price rise for a third dose should have been all over the papers, but it was like we were just grateful we could get it. It was very insular the way we managed it.
Absolutely. And one thing that, Diarmuid mentioned earlier is that the narrative, I as an academic have been watching the narratives change constantly. So, in early 2021, so more than a year ago now, the narrative was, as Diarmuid said, there's no capacity in the global south. They simply can't do it, or they can't do it safely, that it would be dangerous to allow them to do it. And as soon as that was debunked, the next one was, well, we simply can't transfer the technology. We're too busy, and anyway, it doesn't matter. We're going to deliver 2 billion doses by the end of the year. So, the private sector can take care of this. And we don't need to share the know-how and so on. This narrative, and then of course, once that was debunked and it was clear COVAX wasn't going to be able to deliver that much, and that the donations were creating all sorts of problems in terms of expiry. The next narrative was, well, if you have any weakening of the international IP system, this will kill innovation. So, in the academic papers that I've been working on, we've been working to go through, we take these very seriously. We're not dismissing these arguments, but we're taking them seriously. And the evidence we found is that these are all arguments that don't stand up, as we've already heard this morning. And the latest one, for example, in the new book by Bill Gates about pandemics, is that the big problem is that it takes too long to do the trials, that it can take 12 months to do the trials. When you create a generic vaccine, it's a longer process than generic drugs. Now, this is not what Bill Gates was saying a year ago when he was saying it's simply impossible for the global south to do this, was very much what he was pushing. And so, you know, it is the point about human trials is true, but let's look back at the timeline here. I mean, the call for a TRIPS waiver came in October 2020. If we'd acted then, and if we'd shared everything that we had at that point, there was enough time to do those trials.
Listen,
in the context of an expedited process, which we've seen. So, I mean, you know, at every stage, you know, the narrative from the defenders of the status quo is to put up new hurdles all the time.
Listen, Luke, so, we've kind of slipped into our panel discussion, and I'm very conscious that Fatima is waiting to go, and Fatima will, of course, give you your full 15 minutes, and that was a taster of the discussion to come, which I think is going to be really interesting. So let me introduce. Thank you very much to Luke, and let me introduce Fatima Hassan, who is a human rights lawyer and social justice activist, and the founder of the Health Justice Initiative. She's former executive director of the Open Society Foundation for South Africa, and has had many other roles on critical organizations dealing with equity, including work for various different councils and coalitions. It's a very impressive CV. So thank you very much for joining us today, and please go ahead.
Thank you, and thanks to Alice and Luke and Candace and Diarmuid and many people who I've only just met on Twitter. So I'm hoping that you can all hear me, because I think we're going to have a fascinating conversation about racism, because I think that's sort of what Luke and you were just discussing as a prelude to the panel conversation. And as somebody who's living in South Africa down the road from the mRNA hub, you know, there's a few things that I just wanted to highlight today. The first is to thank you for the global solidarity and support. And I think that people may think it's not making a difference, but it is. When we see people standing up in, I don't know the terminologies, but to the equivalent of the Irish Parliament, saying that you support an unequivocal waiver to stand on the side of patients and non-profit, that is significant for us, because it's showing to the world that another way is possible. And that's the way that I want to talk to you about. Unfortunately, however, the next 2 weeks are really critical. And in the last few days, the UK government, what I call the Partygate administration of Boris Johnson, has actually is using new tactics and strategies to even dilute a very narrow text even further. And we can talk about the very bad faith role that the UK government is currently playing, and all of the work that you're going to have to do to hold the UK government to account in the next 2 weeks in particular. And at the heart of that bad faith strategy or move or deliberate tactic, which is premised on a lot of vested interests, is the desire to further prolong this pandemic and to exclude treatments and diagnostics from the remit of any kind of immediate proposal or resolution on the TRIPS waiver. And so what we currently have is this most absurd and I think really racist situation where 2 years into this pandemic, at least 15 million people dead, you know, some estimates are 20 million, 13 trillion in economic losses. We have a situation where the world leaders are still only discussing how to remedy the situation of vaccine inequity when there's so many other elements to the COVID-19 technologies that were discussed in the initial October 2020 TRIPS waiver proposal by the South African and Indian government, and that still needs to be addressed. So I wanted to preface some of the elements that James asked me to speak about, which I spoke about recently in an acceptance speech for Mount Royal University, which is available on the PLOS Global Health site, and that is extraction. And a few weeks ago, the Committee on the Elimination of Racial Discrimination said that they found a pattern of unequal distribution within and between countries, and this is just on vaccines, replicates slavery and colonial era racial hierarchies and deepens structural inequalities affecting vulnerable groups. So I want to use that as a springboard to talk to you about 4 specific issues that we found in this pandemic that actually lends itself to this idea of colonialist extraction. And I think that these 4 issues are so intertwined into why there is so much opposition to not just the TRIPS waiver, but to any effort to share technology, whether it's CTAP, whether it's COVAX, whether it's the mRNA hub in South Africa. They are powerful vested interests. In some cases, this industry is even more powerful than oil and gas together, which don't, signal a very positive way forward for how we're going to deal with climate change, or how we're going to deal with the way in which corporate companies basically exercise their power and their market monopolies. Because if this is allowed in this pandemic, then basically you have free reign to behave in very similar extractionist ways going forward. And so the 4 elements of extraction that I wanted to focus on was profit, where you use a pandemic to gouge, to extract excessive profits, and I'll explain some of that shortly. You extract trial participation, particularly of participants in the global south. You extract secrecy or democratic practice concessions, and I'll explain what that means as well. But basically, you undermine sovereign democratic traditions or countries by extracting concessions on contracts. And then you extract knowledge. And you extract knowledge for the purpose of hoarding and for the purpose of profit. And so obviously all those 4 elements of extraction are interlinked. So first, let's just look at this element of profit. In 2021 alone, Pfizer made $37 billion in a pandemic on its vaccine. Now, if you think that that is shocking, they are estimating that by the end of this year, and within 6 months, that they are likely to make $100 billion just for Paxlovid and its vaccine. So the stakes are really high to not want to share technology, to not want to allow others to have full manufacturing rights, to continue to exercise absolute intellectual property, monopoly power and control, because the opportunity to extract profit at an unprecedented scale, while the world has suffered the various socioeconomic losses it has, is basically there for the taking. It's what we call the golden egg syndrome. And aside from the fact that a lot of these vaccines were heavily publicly funded and there was significant public investment in many parts of the world, the people actually own this vaccine. It's not these companies. And separate from that is actually whose innovation was it? I mean, in many cases, the mRNA, which I'll talk about later, comes from knowledge that has been generated by people who have been doing work on HIV and Ebola for decades. Moderna's profit margin for 2021 was 70%. So it's a blockbuster vaccine. It's not even their own. I mean, we've argued it belongs to the US government. And so they were making about $36 million a day last year off the back of that particular vaccine. So the system, including TRIPS, including the WTO, including the way the G7 and the G20 operates, including the entire global health infrastructure and architecture, allows and enables and permits companies, even in a pandemic, to be making such excessive profits, and allows them to extract billions. And for as long as you can hold on to your IP and your control and your knowledge and your power, you are able to extract more profit from the system. If you give up your IP too soon, you then potentially make less profit, but more importantly, you have less control over how that knowledge is used. The second way in which extraction has happened has been trial participation. So somebody, I think Alice mentioned the word solidarity. Quite early on in this pandemic, we said, it's just a word. Don't believe it. Don't trust benevolence, because we will be promised things like we were in the HIV/AIDS crisis, but we will never get access at the same time as you, because frankly, our lives matter less, because we're black and brown and it doesn't really matter. So the world has accepted and whitewashed a system where it said that a 75-year-old person in Ireland will get access to a vaccine first, and that's okay, before a 75-year-old person living in Africa. All right. And yet we were told, participate in these trials, contribute to global knowledge. Let's find a vaccine. We're all in this together. So we did that. In South Africa, we participated in 4 clinical trials. Do you know what happened in the last few weeks? After everything that has basically transpired in the last 18 months or the last 2 years of this pandemic, with Moderna not sharing its technology, refusing to supply vaccines to low-income countries, only giving vaccines to COVAX after the New York Times did a huge expose, filing patents in South Africa, not agreeing to participate with the mRNA hub, they've started 2 trials in South Africa. The first trial is amongst unvaccinated HIV positive people in Africa. Now, if this was happening in Ireland or in the UK or the US, there would be an outcry. This is a company that has hoarded knowledge, has called the mRNA hub a nice to have, likened it to a fake Louis Vuitton handbag, has extracted millions of dollars in profit, that is now doing a trial to try and show the efficacy of what they're going to call the booster vaccine. And so we need to at some point talk about what's going to happen when booster programs are being introduced in Africa by the mRNA vaccine companies. Similarly, they're now doing a trial with healthcare workers who receive the J&J vaccine to give them a booster shot. So they haven't submitted their regulatory dossier, but they're actually doing trials in our country. This is in 2022, whereas Pfizer, AstraZeneca, Johnson & Johnson all did this in 2020 and 2021. So our participation is being extracted in this current system because we're all supposed to contribute to this knowledge of how does a vaccine work in certain populations, etc. But we're not getting any benefits. We're not in the front of the queue. Certainly, there's no benefit sharing agreements. Like Luke said, there's no conditions being attached to these clinical trials. And so it's an extractionist way, in my view, of telling people to participate, but then not guaranteeing any kind of post-trial access. The third way in which the extraction is working, which is really quite sinister, I believe, is that some of us actually do live in democracies. I live in a country which has a constitution which is supposed to prioritize open procurement. The companies that decided to give us vaccines at a later stage than knew in the global north, so not at the same time, with the drip feed of supplies, insisted on non-disclosure agreements, insisted on secret vaccine contracts going against the very principles in our own constitution. And it was basically a hostage situation. If you want the vaccine, you have to agree to all these terms and conditions, which basically puts a number of restrictions on our government's ability to basically have any kind of control or power in terms of managing this pandemic. The worst has been the non-transparency on pricing, the broad indemnification cover that's been given to these companies, and then language that has been inserted where the CEOs will decide where the vaccine deliveries will go first. So when we're talking about this narrative that the industry is peddling about there's sufficient vaccines, it's not the technology, I think we really need to understand that it's much more complex. And if one can actually get access to all of these contracts, which we are now suing for because nobody wants to disclose them, and many other activists around the world are doing the same, you will realize what we mean by excessive amounts of power and control in this pandemic by CEOs who are basically unelected. They're not senators in a parliament, they're not elected members, they are not accountable to anybody, but they are making all the decisions around where vaccines get manufactured, where they are sent, when they are sent, whether you can donate, whether you can sell them on. I mean, it's a real perverse system that doesn't actually encourage collaboration or solidarity or even openness. And then finally, there's been an extraction of knowledge. We've mentioned earlier that the mRNA platform wasn't just developed within a year or 12 months. It's on the back of research of public scientists, particularly government scientists who've worked at the NIH and the US government, which is why we've been saying to the Biden administration, this is your vaccine. This is the people's vaccine. You can step in both in relation to Moderna and Pfizer on the mRNA platform. But the worst, I think, example of this idea of extract profit, extract participation in trials, extract secrecy, but then you set up a hub in South Africa and you don't cooperate. and you are actively trying to sabotage and undermine it. A hub that can actually, hopefully, be a solution to not just COVID, but to HIV and TB as well. Diseases that really need the world's global attention and cooperation. So what we have is a knowledge hoarding in relation to the hub, where researchers are assisting the hub. They're doing this secretly. This is what the one of the directors of the mRNA hub has told us, that a lot of the medical research community has basically said, we're fed up with the system. We're going to support you privately and secretly. We're not going to tell the companies that we're doing that. And so they've been able to make breakthroughs. And those breakthroughs, hopefully will be able to benefit millions and millions of people if Moderna doesn't enforce its patents, if Pfizer doesn't enforce its patents. So what you have is a system where you are responding to a global pandemic. You're trying to generate knowledge that could actually benefit humanity. And I mean, it's not a slogan. It really is happening down the road from me. But you're worried that two CEOs could decide tomorrow, okay, the pledge is no longer in place and we'll now enforce our patents. So the whimsical pledges of CEOs is not necessarily helping. And then finally, I just want to say that if we're going to address what has gone wrong in this pandemic and what has gone right in this pandemic, then yes, the TRIPS waiver is one part of that. And like I said in the beginning, the next 2 weeks are critical. But we've got to find a way of not just doing press statement after press statement or calling people out. There's got to be a way in which we can actually address the systemic issues and the systemic constraints and barriers. And part of that has to be, sort of the work that Luke and others are doing, Siva as well, is calling out the complete failure of the WTO to actually get us out of this pandemic. And there's a certain irony, if not shame, if not just pure exasperation, that we have to look to a trade body to get us out of this pandemic instead of looking to a health body to get us out of this pandemic. And this happened to us before in HIV/AIDS. I mean, the Doha Declaration was because we lost millions of people in Africa because they refused to give us the drugs on time or refused to issue the licenses on time. So we've been here before, we're in it again. We've made some progress, but I think finally the world is more alive to the limitations of the TRIPS model and to the limitations of having IP monopolies dictate the pace of a pandemic. Thank you.
Thank you very much, Fatima. That was really, it was a really kind of fitting tying together of the themes of all of the earlier talks, and really does lead very nicely into our discussion. If I could get the panelists to put their cameras and mics back on, and we do have, please do keep your questions coming into the chat function. That would be very useful. So I can see we still, on the panel, we still have, we have everybody. That's fantastic. Okay, we have all the speakers. What I might do is, there's a question I think that would be good to kick things off, which is very much an immediate focus about what we need to do now, particularly over the next 2 weeks. And it's from Kira Barry. And she says, what are the next steps in the global campaign for the TRIPS waiver? And I suppose it'd be really useful for us to focus on what can we do in the next 2 weeks leading up to the WTO Ministerial Conference. And maybe if each of you has a suggestion that participants at this meeting can take away with them, something practical that we can do. I might just start in kind of the order of the speakers as they should have been. So Senator Higgins, do you want to, Alice Mary, do you want to kick off on that one?
Yeah, sure. So something I should, and I think it was mentioned in the chat, I mentioned the Foreign Affairs Committee back in March 2021 in the autumn, that my motion, the Shannon, but really recently the Enterprise Trade and Employment Committee had hearings with civil society looking at the question of the new proposals. And I believe, I've just seen it in the chat, and I would believe it, given that I think there was strong cross-party criticism of the failure to provide a TRIPS waiver, that there was a very good, in that session, a very good dissection of why the new proposal that we're being told, is a solution, why this new proposal is not adequate in terms of, this is yet another delay mechanism. So I think what needs to be really important is that the next meeting doesn't become the meeting where we're discussing the I'm trying to remember this kind of weird halfway house proposal, which I think Candice did a really good dissection of exactly why it doesn't stand up, of why it's really kind of more of the same, and in fact rolls back on some of the measures. It actually worsens some of the measures under TRIPS, under the TRIPS as it stands. So I think basically it's really important that the next World Trade Organization meeting is a meeting where a full and real TRIPS waiver is being discussed, rather than this inadequate proposal from the EU, which doesn't really seem to have backing from anybody, placing itself as center stage, and then you get a narrative, of the European Commission saying we did our best, but no one would work with us, or something like that. So we need to be really clear, and I think it's really useful that the most recent meeting of a committee here in the Irish Parliament was looking directly at that proposal and directly identifying that that was not adequate. So again, I think that's just really important going in, and maybe a really strong message to go in to say a real TRIPS waiver on the table. And that needs to be the question that we're asking ministers from every country. It needs to be the discussion we're having afterwards, and they need to know in advance that we won't be fobbed off by, conversation about this yet another proxy delay, because every time, as I said, it's 2 months, it's 3 months more of a delay.
Yeah, I mean, maybe we need to be using the term a real TRIPS waiver, getting that into the speaking leading up to it, because I do agree there's such an obvious sidestepping and distraction by getting too wound up. Candice, do you want to comment on this particular question?
Yeah, so I do agree with Senator Hughes that, I think it's very important for us to really emphasize on the need for us to go back to the initial proposal. And I think just as civil society in general, and I think particularly also civil society from high income countries, just really also highlighting how developed countries have really failed low and middle income countries. I think that's a very important thing that needs to be pushed, that they've failed us. They failed us in this process. And I think, beyond just the World Trade Organizations, I think developed countries have really failed us. And I think that's something that we really need to push more strongly in the lead up to the MC12. So yeah, I think that agreeing to Mary Higgins that we need to go back to where we started. We need to go back to the initial proposal. And yeah, I think, as civil society, this is a very, critical moment for us to come together again and really go into the streets and really make a noise around us getting what we initially proposed.
Okay. Luke?
Thanks. So, if there are any academics watching, I think that all we can do is give our expertise where it is. That could be in expertise in global health, that could be expertise in the law, it could be trade law, it could be intellectual property law. In our paper, which the link has been given in the chat, we refer to the current draft as the DG text. It's the text that has come from the Director General of the WTO. It emerged from talks between 4 parties, the Quad, the EU, the US, South Africa, and India, but none of those parties has taken ownership of the text. So it really is the text that the Director General has kind of cobbled together. It is obviously a bit of a hodgepodge for that reason, but legally, the way it's framed is as a decision, not as a waiver. It's a much more narrow document than the initial waiver proposal. So it's perfectly fine as a legal term to not refer to it as a waiver. It's a decision, or as we call it, a different text, and it's much, much narrower than the original proposal.
Okay, thank you. Diarmuid, I know you dropped out for a moment there. I don't know if you want to make a comment on this question around what can we do in the next 2 weeks leading up to the Ministerial Conference?
Thanks, Susan. Yeah, apologies. So I didn't hear any of the other contributions apart from Luke's there at the end. So if I'm repeating the things others have said, forgive me. I think one of the things that we've struggled to do the most in the UK is to make politicians aware of their personal culpability for the deaths that are occurring around the world. And And I think that's what we'll be trying to do. And I think it's what people in Ireland should be trying to do with Leah Varadkar and Micheál Martin and others that are involved in the senior decision making on this, is to highlight to them that the positions that they're taking, using, very well, very undermined arguments to defend the status quo, the positions that they're taking are leading to the unnecessary deaths of Black and brown people around the world, and that those the racist, as Fatima has highlighted, positions that they are forwarding are completely unjustified, and that they will be held morally responsible for those whenever their behaviour in this pandemic are remembered. I think when we look at some of the actions that are the motivating factors that are determining how politicians and what decisions they're making, particularly in Western European countries, we realise that there is political expediency at the heart of that. There are financial and political motivators at the heart of them, but ultimately the people involved think of themselves, I think, in the most part, as decent people doing the right thing. And I think there is a vulnerability in that innate sense that people want to be, like to think well of themselves. And I think there is a vulnerability there that I think we should be pushing for, because I think no politician wants to be remembered as one who's responsible for being on the wrong side of history, and to feel that they have blood on their hands. And I think very simply, this is a personal decision that those politicians are choosing to make. This is a political choice to allow people to die, and I think they have got to feel that level of personal responsibility and political accountability for the positions that they take. We'll be doing our best to put that to the UK government and to Boris Johnson and to Anne-Marie Trevelyan, and I think the same should be put to Micheál Martin and to Leah Varadkar and others in the Irish government.
Thank you. Yeah, I think you have a lot of people who would be in agreement with you. They don't seem to be too strong on taking personal responsibility generally at the moment, but this is something that we really need to emphasize. Fatima, would you like to comment then on that last question around what's the immediate action that we should be taking?
So, I think there's three key demands, and then the immediate action is obviously dependent on your context, but you're in a unique place because you can actually challenge the UK government. And like I said, currently the UK government is a major obstacle. And what they've done in the last few days is propose new language to the DG text that further dilutes any kind of potential concessions that you could even get from the waiver, and that's deliberate. So the three demands are: you can't have an agreement that is TRIPS plus. That's self-defeating. And if you're going to have an agreement or a decision that has more conditions than what TRIPS currently has, then that's TRIPS plus, and it makes no sense because it will be so difficult to use. The second key demand is, goes back to what South Africa and India said in October 2020. You can't address this pandemic with only vaccines as your arsenal. You need diagnostics, you need treatment, therapeutics, Paxlovid, for example. You need ventilators, you need PPE. And that's what's called all COVID-19 technologies. So limiting this discussion and the so-called waiver to only vaccines, and then saying to us after we've waited for 18 months, so there isn't really a great track record of expeditiously moving on anything, or we'll come back to diagnostics and treatment in 3 or 6 months. Well, simply we don't trust the EU or the UK to do that. And can you imagine the conversation that will then happen? And every month, like I said earlier, that passes where Pfizer is able to exert more control and determine the terms and conditions of their licensing. I mean, they've excluded Brazil from the Paxlovid license. How is this making sense in the middle of a pandemic? Is a month that we're going to be losing more people, particularly because we have what's called a low vaccine uptake in some parts of low-income countries. You actually need treatment. That's what people are looking for and what they're asking for. So it's a really bizarre, self-defeating public health strategy to say in 2022, well, now we'll discuss vaccines and you've got to all wait on the diagnostics and treatment for months later. So I think that has to be the second demand. Why are your governments negotiating a tax? And primarily this was driven by the US government, and the US troops are working on that. And so the specific things to focus on the UK government is why have they gone and proposed language on anti-diversion, on notification, on eligibility, on patentability? If you are going to exclude the countries that can make these technologies from being able to benefit from the waiver, then what's the point? So, the attempt to exclude countries, to force them to opt out of the waiver, to make it even more difficult to use a measure that's already accepted under TRIPS, like compulsory licensing, just really makes no sense. And sorry, I should add that it's the UK and Switzerland who went and did this in the last few days. It's not the UK alone, but we believe it's been driven by them. So writing to the equivalent of their trade minister, writing to the administration, getting some transparency on the text. I mean, you can't respond to a pandemic as activists or as academics or as lawyers or all of us when we're having to rely on Politico to, on a daily basis, give us the so-called leaked text. I mean, there's no transparency in this process. And aside from that, 100 countries supported this proposal. There are 65 co-sponsors. Yesterday, a Nobel laureate, an economist, Joseph Stiglitz, said, the provisions in the text are a step backwards, and this makes us less prepared for the next pandemics. It's not just activists saying this. I mean, former world leaders, Nobel laureates, the Vatican, faith leaders. I mean, I think there's a global movement of people who are echoing what we have been saying and what we have been warning about.
Yeah. Okay. Thank you very much. I mean, there's no doubt that we need to have, urgent actions over the next coming weeks. I suppose that leads nicely, Fatima, what you're saying is about the idea of preparedness for the next pandemic. And there's a question then around that we've obviously learned a lot around access to treatments from HIV. And this person is wondering about whether the strategies adopted by NGOs in creating access to medicines have changed over time. So I suppose that really is about what have we learned for future preparedness, and do any of you have? I mean, we've limited time. Are there solutions? Are there alternatives to our current R&D models? That we've learned about from the HIV experience and now from the COVID experience. And what I'll do is I'll go in reverse order. So Fatima, do you want to kick off on that one?
Look, I'll just be short on this. Aside from emphasizing that we need proper post-trial access and true benefit sharing agreements, like we do with gold and diamonds, right? You can't come into Africa anymore and just take gold and diamonds without like genuine benefit sharing. I think that has to be a critical feature of reforming the entire way in which research is being done, the way research is funded, and there has to be more transparency on the R&D costs. So, this argument that Pfizer says, well, I need to charge that price and make so much profit because the R&D costs, it costs me so much. Let's have more transparency on the true R&D costs and the cost assumptions, not just for Pfizer's vaccines, but what Dem had mentioned about Vertex, right? A key life-saving drug for cystic fibrosis, or what Candace mentioned around baricitinib or drugs for HIV and TB. I think there's just been too much of a free rein for companies to basically get away with what I call gouging, basically, not just in this pandemic, but before this pandemic too. Thanks.
Yeah, you're absolutely right. And Dermot, it's a natural move to go on to you next there.
Yeah, I think it's really interesting. Basically, there's a couple of very obvious motivators in terms of the pharmaceutical industry's opposition to the proposed waivers around intellectual property rights on COVID. Very, very directly and very immediately, they're making a hell of a lot of money with those monopoly protections in place. That's a very simple calculation for them to make. The risk to those profits is very, very immediate. But I would also say that there is a longer term game here, and the pharmaceutical industry do think long term. They have been fighting tooth and nail on anything that could be perceived as being a weakening of the architecture of the industry right now, and they want to strengthen the architecture of that of the current model. And if we see that lives can be saved from a different approach in the context of pandemic. The question will be rightly, if we can save lives by changing these rules so it's more just, then so that we can save more lives from cancer, cirrhosis, from tuberculosis, from any antivirus. Okay.
You're dropping out. Your internet isn't great, Dermot. Sorry.
For one, does not relax.
Yeah, you're dropping off
Sure.
a lot there, Dermot. So, I mean, I think what you're saying there is the transferability to other.
I'll stop my video just to you.
Okay.
Yeah, and just to finish the point, hopefully without the video, you can hear me. Is to say that yes, I think there have been extensive studies of how innovation can be incentivized in other means.
Oh dear. Okay, I think that's a definite gone. So maybe I'll hand. I mean, I think we got the power of his message there. So Luke, what about what have you any thoughts on alternative systems?
Yeah, I mean, I think in terms of, I go back to the point about learning lessons, and one of the things that's been quite inspiring about the last 2 years has been the collaborative projects that have started that are working on a not-profit basis. So the mRNA hub in South Africa is a real beacon of hope here, and it's already working to distribute that technology throughout the global South. So, South-South projects are what we need to see more of in the future. And I think what was particularly useful about what the hub has done is that they called Moderna's bluff. Moderna made this kind of pretty bland pledge that we're not going to enforce our patents for the pandemic, but they didn't help the hub at all, or participate in CTAP or any of the other voluntary licensing measures. But the mRNA hub said, well, we're going to call your bluff and we're going to concentrate on that technology. And they received some assistance from the NIH in the US about the underlying mRNA technology. And now they have achieved what Moderna did not think they could actually achieve. So while it is important for clarity, for legal clarity, to have something like a waiver or a general lifting of obligations under the TRIPS agreement, there are ways within the Global South that organizations, institutions, companies can call the bluff of Western companies when they say, you can't do this. And it's been great to see some of that happening already. And of course, the other positives then are things like Corbivax, which is the open source model that, people said that wouldn't work. One of the reasons why Oxford picked a sole company, AstraZeneca, to work with was that they were advised that the open source model wouldn't work for something like a vaccine. Well, Corbivax has managed to do it. So that's very positive. Some of the sharing of the Cuban vaccine technology has been very positive. So I think that South-South cooperation is something that I think will hopefully continue.
Okay, thank you. That's nice to hear something positive. I might, Candice, would you like to come in then? And then we'll go to you, Alice Mary, then for final word.
Yeah, I mean, I think from my side, I think what this pandemic has really highlighted is the need for us to do a whole system, a change of our system and how it works, right from how we do R&D and really, prioritizing research and development based on, health needs, not neglecting needs, of low and middle income countries, the need for our patent system to change. But now I think what is also on the table is around, even our procurement system, from, pushing for local manufacturing and having some bits, for example, like with the Aspen example, where they, were during this Johnson & Johnson vaccine, but however, also threatened, they might possibly be closing down their vaccine plant because they're not in a position, or rather they're not supplying vaccines due to various reasons. But I think what this is highlighting is also the need for us to have systems and policies in place that would ensure that even when we have these local manufacturers, that they are also integrated into a global system that would enable them to be able to supply to a sort of a global sort of setting. So I think it really highlights the need for us to do a whole system change from R&D to supply policies to ensure that local manufacturers or manufacturers in low and middle income countries are also integrated into this global system. Thanks.
Okay, thank you very much. And we won't have time for any more questions, but I think we've come full circle now, and maybe Senator Alice Mary Higgins, if you want to respond to that question, and if you have any kind of closing guidance for us.
Well, no, I will. I might just add, on the previous question, I do want two really quick points, which is, I do think that point Fatima made around that there's a backward step, not that it's not adequate, but a backwards on the existing trips, I think was really important. And I also think it is important in terms of Diarmaid's point, in terms of political responsibility. There are those who just don't want to feel responsible for it. So I think it's really important that ministers for health are not allowed to push this issue over to the Minister for Enterprise. And similarly, that heads of state, Taoiseach, prime ministers are not allowed to say this is solely a matter for the Minister for Enterprise. It needs to be treated in that way. So I think it's really important not solely to target the Ministers for Enterprise, who are often the most maybe embedded in the current models, but to target other ministers and those who sit at cabinet with them and insist that you are looking for responsibility from all. So I just think that's maybe a message on that. I think in terms of what I think is really interesting and that we've learned from it and that is important, first of all, I would say we had already learned from the HIV pandemic. And that's why, as I said, a really good architecture was proposed right back in, from the technology access pool, the idea of COVAX, in that original idea of the 20% everywhere, and the TRIPS waiver. Those were really good decisions, architectural decisions proposed there, available to be used before the vaccines were even finally invented. So we had that architecture there and it wasn't used. So I think there's a learning from there, not just around what a new architecture would look like, but the fact that that needs to be a harder architecture. So, and again, I think what's really interesting is in their absolutely tooth and nail defense of the status quo, I actually think that the major economic actors here have proven that the status quo doesn't work. So I think, in fact, if they were wise, they would have engaged with all the voluntary options that were given to them around things like the technology access pool. They would have engaged and delivered on COVAX. They would have used the option for a TRIPS waiver, which is an option that is there to be used within the existing architecture. But by the very fact that they have not stepped up on a global pandemic, and the fact that they did not want to challenge business as usual, in protecting business as usual, they've actually undermined the credibility of the status quo architecture. And they've shown that it is not flexible. And we hear a lot, about private enterprise and its ability to innovate and be flexible. It's shown that it is not able to innovate. It is not able to be flexible. It is not able to respond appropriately to global public health need. And in that context now, they have, in fact, by failing to take, I would say, the better option and the easier options that were there, made the case for new kinds of architecture. So we do need things that were like the COVID technology access pool, but that are harder and stronger in terms of, we need to have mechanisms which will be much quicker and firmer around things getting shared. And of course, that was a really useful, that would have allowed the patents to be protected, but shared. That needs to be firmer. Things like COVAX, it's not enough that there would be this idea that there should be 20%. That needs to be legally, economically hard enforced when you have issues like promises being made on those contracts. In terms of research and development, yes, we need an absolutely new approach, because, and I think it was really, South was mentioned by Luke, something that I've been pushing strongly, because it links between the South and the Northern countries, is public-public partnerships. So that's not just internally, nationally public-public partnerships, but internationally public-public partnerships between different countries and their public bodies. And it's a little bit of a depressing sign. In one of the questions I put into the Department of Enterprise at of Education, I think it was at one point, I asked about Ireland's investment in public-public research. And I got back a reply, do you mean public-private research? Because it was the envisaging of public-public research is not there. Lots of universities have memorandums of understanding in terms of how they partner with companies, but they don't have the same kind of MOUs of how they do public partnership. So that needs to be key. And then countries like Ireland, which give massive tax breaks for research and development through kind of things like the knowledge box, where we don't even know what happens in them, we need to be going after things like those research and development tax breaks. So it's not just around the kind of, there's the public investment in research and development, but there's also questions around the indirect public subsidization of research and development through tax breaks for companies. And we need to be saying, is that actually what's going to deliver value, public good, dividend for the world? So I think it's a really key moment. And I think the next few years have to be about increasing research and development, public cooperation, and particularly in the global South, manufacturing capacities, which were already there, but they certainly need to be, and we need to have a harder architecture where we are not at the whim of a few companies. And again, I think the case for change has been made. And the last thing I would say, I mean, I used this analogy, when in the debate on climate change recently in Ireland, and I spoke at the same time about vaccines. So again, it was the idea, that if we're in a building on climate change, that we're having these long discussions about whether or not to turn the taps off and how we might turn them off and which taps will turn off first and who should, while the ground floors are flooding already and people are dying. And similarly, I think in terms of the vaccines, we have shown that the architecture we have right now, the idea of the quibbling at the high levels around how much we might help and whether we might help, and let's brainstorm other solutions, while death levels are rising, is unacceptable. And so I think, yes, we have learned. We knew already, we told, and NGOs and people like UNAIDS told political leaders, and indeed they told business structures. It wasn't listened to, and now it needs to be told much more strongly, demanded, and reinforced. And again, I think that is going to be the challenge over the next few years, that we need to step up. And the last thing I would just say is, I think there was a question that didn't get answered around the vertical and the horizontal. Yes, we can't wait to deliver this just disease by disease, crisis by crisis. We have to acknowledge that damage, and I like that phrase gouging, I've used it in another context, and I like to hear it used here too by Fatima, that damage has been done to the global public front line in terms of health. And so there is also a work of reparation, of repair, of investment in all those other parts of the global health system which have been hit. So we need to have a massive scaling up of funding to community clinics, to hospitals, to ICU units in developing countries, because we've had a backward step. This isn't about neutral. We've had a backward step on global public health here, and that's going to need repair as well.
Thank you very much. Unfortunately, we have run out of time. I think we could probably go on, talking about, there's so many issues that are critical, not just for COVID, but for health equity more broadly, both within our countries, between our countries, but particularly, that our resources and our delivery should be based on need and taken with a global perspective. So I'm going to just wrap up. I want to particularly thank the people who were behind the scenes organising the meeting. So that's Maisie Jones and Aveen Collery from the Irish Global Health Network. Without them, They even managed to survive me losing electrical power halfway through and stepped in very ably. Thank you. James Larkin from Oxfam, and Siobhan Murphy and Michael McCarthy Flynn, Siobhan from Amnesty and Michael from Oxfam, who were very involved in the initial planning stages of the meeting, along with Kieran Harkin from Doctors for Vaccine Equity. So there's a couple of things. We focused a bit on what we can do immediately. Well, we mentioned at the beginning the no profit pandemic petition, so please sign that. We're also kind of suggesting that people make or take a picture of themselves with some kind of homemade sign around the TRIPS waiver, you know, obviously supporting a real TRIPS waiver, and send it to their local politicians. And there will be there's a link that will go into the chat about how to identify your TD, and there's also text that people can use to email. And I really like the idea that this is not a trade and enterprise issue. I mean, I'm a healthcare worker. I want my health minister to protect my vulnerable patients coming into the next few years. And I'm really worried about variants. And, you know, just, I know from clinical practice, everybody thinks this is over. They want it to be over, but it just isn't until we have a kind of an equitable distribution of resources. There's a meeting coming up that I think may be of interest to some of you. That is the World Association of Family Doctors has the Irish College of General Practitioners is co-hosting the rural version of that. And one of the opening plenary sessions on the 18th of June is focusing on health equity and vaccine equity. So if you Google rural Wonka, you'll be able to look at that meeting. And I think that's going to be a really good discussion as well. So I've covered the issues around the TD campaign, the petition, and I suppose I'll just finish up by particularly thanking our speakers. It's been just it has felt like such a topical, up to the moment update about the current situation, and really has lived up to the message of this meeting that the pandemic is not over, and that we really need to learn how to manage it right now going forward. But also that we need desperately to learn from it, both for future pandemics, but for our health systems and for health emergencies, and for fair access to medicines, both nationally and globally. So thank you very much, everybody. And if you have any queries, I'm sure you can drop them into the People's Vaccine Alliance. But again, final thank you to our speakers. You were all brilliant, and thank you so much.